How you doing, Dr. Bailey? I'm going to be assessing you today from about the base of your head about down to your waistline. Without exposing any skin in that area, is it okay with you?
Yes.
Have you been cleared and clean to be adjusted?
Yes.
Do I have permission to palpate you today?
Yes.
Okay. Check the table. Okay. I'm going to have you sit facing the windows with your shirt off. Start the general.
I don't know if he's awake or asleep back there. If you come in here and you see the projectors projecting something on the screen, what you'll do is come over here, open this door. Just go ahead and move it, and we'll make sure the keyboard's there. There's the deal we can use on the screen projection. Good. Move that right there. Put that screen lit. On this right here, it's gonna be on the word on. We'll reach over here off, and you push it, eventually it'll catch. Some of these screens will start going up, but the picture will go out, it'll turn off. If you happen to see one of the wireless ones.
When assessing the atlas, doctor position was standing behind patient, patient was seated, line of drive for rotation, P to A for lateral glide, lateral to medial, contact point, doctor's chiropractor finger, segmental contact point, lateral glide, transverse processes of the atlas, lateral aspect for rotation, the posterior arch of the atlas. Restriction found PSRS. Can I have you stand facing toward the wall? And with your eyes closed, could you look down and up, and stop it when you feel a neutral position? Okay. Okay, I'm going to assess lateral glide of your atlas. First, we're going to palpate in, down the mastoid, just posteriorly.
See, that's when I first saw that, I was like that. Right.
Then I'm going to assess rotation. Palpate in, take a tissue pull, press P to A.
Let's see, she raised it
Palpate in, tissue pull, P to A. In assessing the T6, T7 segments of the thoracic spine, doctor position is standing behind patient, patient position is seated, segment of contact points for flexion and extension. This is the inner spinal space of the thoracic spine, or a T6, T7 segment. The line of drive is P to A. When assessing lateral bending of thoracic spine, T6, T7 segments, the segmental contact point was the lateral aspect of the spinous processes. Line of drive, L to M, S to I. When assessing rotation, segmental contact point was transverse processes. Line of drive, P to A, L to M. Report of findings, PRS restriction. Okay, can you fold your arms around your chest? Get you to bend forward. And back. Forward. And back. When assessing the T6, T7 real pairs for elevation, my segmental contact point was the inferior border of the rib, line of drive, I to S. For depression, my segmental contact point was the superior border of the rib, line of drive, S to I. Doors behind your back so I can assess your ribs. Okay. Can you call Sean for me? When it's doing a full examination of the pelvis, patient position is prone, doctor position is scissor stance alongside patient. Assessing posterior glide of the SI joint, segmental contact point is the SI joint and the ASIS, line of drive, A to P. When assessing anterior glide of the SI joint, segmental contact point is the SI joint and the ankle, line of drive, P to A. When assessing medial rotation of the SI joint, segmental contact points, SI joint and the ankle, line of drive, lateral to medial. When assessing lateral glide of the SI joint is the segmental contact point along with the ankle, line of drive, medial to lateral. When assessing the sacrum for rotation, segmental contact point is the base of the sacrum, line of drive, P to A, I to S. When assessing for counter rotation, segmental contact point is the apex of the base, line of drive, P to A, S to I. L5, S1 segment. The patient position was prone, doctor position was scissor stance alongside patient. Segmental contact point for rotation was the ASIS along with the lateral aspects of the spinous processes. For lateral bending and flexion, it was segmental contact point was lateral aspects of the spinous processes along with the patient's knee. Line of drive, lateral to medial, line of drive for rotation, lateral to medial. Says posterior glide. Anterior glide. Lateral. We're going to assess your sacrum now. And last but not least, going to assess your lower lumbar spine.